everybody. I'm Pat Wetzel, and welcome to All Things Cancer. We have a really special guest today, James Gordon. Dr. Gordon is a Harvard-educated psychiatrist and a world-renowned expert in using mind-body medicine to heal depression, anxiety, and psychological trauma. He is the founder and executive director of the Center for Mind-Body Medicine and a clinical professor in the Department of Psychiatry and Family Medicine at Georgetown Medical School. Dr. Gordon served as the first chairman of the Program Advisory Council to NIH's Office of Alternative Medicine and as chairman of the White House Commission on Complementary and Alternative Medicine under Presidents Clinton and Bush. You're in for a real treat. We had a wonderful discussion. Here it is.
Who were patients who I would start seeing when I was in medical school at Harvard more than 50 years ago. And I was always interested in the way they looked at the world and their experience. And so right from the beginning, I could see that medicine, although the sort of diagnostic and the professional perspective was really important, that we were missing a good deal of the individual person's experience and the way we treated them, and too often, unfortunately, in the way we listened to their stories. We kept imposing our own perspectives and our own prejudices instead of really being open to hearing what the experience of illness was like from the patient's perspective and what she thought might be most helpful. Now, I was interested in all of this, and I began, as time went on, just to have little glimmers of interest in other healing systems. I began to read about, this is 1969 or 70, I began to read about Chinese medicine. And I was reading in the Peking Review and these stories of acupuncture being helpful to people. And I was, oh, that's interesting, but maybe this is propaganda. And then I saw a study that was done on treating laminitis, inflammation of the hooves in oxen with acupuncture. And I said, well, everybody's saying acupuncture is placebo, but I don't think an ox is a good placebo responder. So I said, this is probably real. So all that was a kind of intellectual interest, and I'd become interested in meditation for myself to quiet my anxiety, make me clearer, make me more peaceful, and be a complement to psychotherapy that I'd experienced and what I was doing with other people. But I got, and then I met someone who was as these things happen, one of the things that I really think is important for people who are watching us is to be sensitive to who appears in your field, who appears in your life, what books appear that might have something to teach you. I've tried always to be open to, well, if somebody shows up and they have something to say, I'd like to hear what they have to say. Maybe there's some kind of reason why they're here in my life. So as I started to really get interested in acupuncture and Chinese medicine and meditation, all of a sudden, a friend of mine brought this Kashmiri osteopath, born in India but living in London. He's an osteopath, an acupuncturist, herbalist, meditation master, fabulous cook, and seemed to me a bit of a dangerous madman as well. he brought him into my life, and he did because he himself had been treated for several months by this man, Shyam Singha, and he'd been pretty much deaf since birth. And Shyam was putting him on a very long fast with only grapes and hot water and treating him with acupuncture 4 or 5 times a week. And his hearing was coming back. He was able to talk with me on the phone. Richard said, I think my hearing's coming back. And I said, Richard, this is the first time we've ever talked on the phone. I know it's coming back. So this man came to the United States and I met him, and I was really interested in what he had to teach, what I could learn from him about acupuncture, about meditation, and really also in general about the limits of one system of medicine, of our Western scientific biomedicine, which is enormously effective, but I was beginning to realize not the whole story. Now, we moved forward about 6 months, and Shyam had come, and I'd spent a couple of weeks with him, and I was really intrigued, and I was trying some things out. And I hurt my back really badly. And I hurt it, of all things, when I was doing yoga. yoga is supposed to be good for your back, but not when you do it in a hurry and you have meetings to get to and you're tense about the meetings. So that's a lesson I've tried not to forget. And the back just didn't get better. And I was really kind of crippled up and in pain. And I had numbness and paresthesias, tingling in my feet. And I was sort of bent over. And I was in the U.S. Public Health Service. I was a researcher at the National Institute of Mental Health. So I could go to Bethesda Naval Hospital and meet with the orthopedic surgeons who stood around me, all, big guys and all guys, all big and crisp white uniforms. And, they talked about what was going on. They said it probably was a disc. Maybe it would clear up. They would give me anti-inflammatory meds and pain relievers, and I should go home and I should start taking them. Well, I started taking them before I started going home, and I had to pull over the side of the road and take a nap because they were quite powerful. Anyway, I got home and I spent a couple weeks, more or less, inactive, which I didn't like at all. I was doing really interesting things at the National Institute of Mental Health, and then I went back and I said, it's not better. And they looked at me, and I remember I could see half of them were thinking, well, he's a psychiatrist, so he's probably crazy. And the other half were talking about a myelogram, injecting dye into my spine to look and see where the disc was. This was before MRIs or CAT scans. And I knew how painful myelograms were. And I knew the only reason to do them was because you were thinking of doing surgery.
Yeah.
And I said, I gotta do something else. So at that point, I called up an osteopath, and osteo meant bones, and I knew they did manipulation. I didn't quite know what that meant. And I went to see the osteopath and I actually called up an office. And they said, who do you want to see? Dr. Blood Sr. or Dr. Blood Jr.? So I thought I was in a Dickens novel. And I said, well, who can I see first? And they said, Junior. I said, okay, let me see him. So I went to see him, and he had me lie. And I never had any kind of manipulation in my life. They never mentioned it at Harvard Medical School. Everything I'd heard was that it was completely bogus and charlatanism or maybe placebo. So but I was desperate. I didn't want surgery. And so I lay on the table, and he turned me to one side and he crunched my back. There was this horrible crunching sound. And my second thought was that I'm going to be paralyzed. And my first thought, being a young man, was I'm going to be impotent. He's done me in. Well, actually, neither one came to pass. I felt somewhat better afterwards. So I thought, this is very interesting. This opened my mind in a whole new way to other than conventional therapies. But then the symptoms recurred, and this went on a couple times. And finally, I called up this guy, Sham Singha, in England, and it was like he was waiting for me to call. And I said, what should I do? And he said, eat 3 pineapples a day and nothing else, and take hot baths with Epsom salts and cold showers, and that's it. And I said, what? I thought I'd misheard him. And he repeated himself. And I said, why? That doesn't make any sense at all. Can you explain it to me? And I'm thinking, I'm a doctor, a researcher. I should be able to understand. And he's saying, you won't understand. I said, what? He said, all right. He said, pineapple has malic acid in it. I said, I understand that. He said, malic acid works on the kidney and bladder. No, works on the lung. Sorry. Malic acid works on the lung. And the lung is the mother of the kidney and bladder. And I'm thinking, works on the lung, mother of the kidney and bladder, and the kidney and bladder are connected with the back. I said, you're right. It makes no sense at all, but I'll do it. So I did it for 3 days, and I was supposed to do it for a week. And on the third day, I called him up again, and I said, because pineapple has tremendous amount of malic acid in it, and my mouth was full of sores. And I was saying to him, my mouth is full of sores. I have 102 fever. My pain is as bad as the day I injured my back. And he said, well, As for the sores, what you should do is coat the pineapple with honey. I'm thinking, why didn't he tell me this 3 days ago? But he says, as for the rest of it, it's good. In Chinese medicine, you have to make a chronic disease acute before it can be healed. And all of a sudden, this whole new worldview is opening itself to me because I know in psychiatry, often when someone is depressed or anxious, they have to go through a crisis and feel worse before things begin to shift around. They have to really experience all the pain and start dealing with it, and then things can change. So I thought, well, maybe the same is true of the body. Maybe the body and mind really are connected very deeply. I said, okay. And I called him up after the seventh day, and I said, he said, you've lost 12 pounds. I said, how did you know? I said, well, I know these things. Well, I had lost 12 pounds. He said, how's your back? And I said, at least 80% better. He said,
Wow.
now go back to the osteopath and let him adjust it. I went back to the osteopath. He adjusted my back. This time the adjustment held. And I've never had a back problem as bad as that again. And not only that, my whole practice, my whole way of looking at medicine, was profoundly affected. And I began to think, well, I've got to question assumptions I have and be open to not only Chinese medicine, but mind-body approaches and herbalism and manipulation and all these other approaches that have been generally excluded from Western medicine. Maybe there's something there, and let me make it my job to find out what's there. And since I'm a researcher at the National Institute of Mental Health, it's my responsibility to make this information available to the American people. So that's how I started on this whole trajectory of investigation and experimentation and writing about and trying to help everybody, including professionals and people with a variety of conditions, learn about this holistic or integrative uh, or new approach, which combines Western medicine and all of the wisdom and experience and benefits of other than Western approaches.
One of the things that comes up in your book that really struck me was the very individualized nature of both disease and healing, which makes perfect sense in terms of what you're saying, that you have to bring all these facets to the table. How does a person, an ordinary person in an ordinary town, go about identifying people or practitioners that can help them come up with that individualized path?
Now, that's a really good and not an easy question to answer. There are, first of all, to some degree, it's disease specific. There are certain people who deal with particular kinds of conditions. But in general, what you're looking for someone who describes herself or himself as an integrative or holistic practitioner, somebody who is both knowledgeable about Western medicine and also is open to both using some of these other approaches and is interested in referring people to specialists in some of these approaches. So, for example, I would like to have as my primary practitioner, whether it's a nurse practitioner or a physician or perhaps a naturopathic physician, somebody who, at a very minimum, actively uses nutrition, mind-body approaches like meditation, guided imagery, works with physical exercise, understands the importance of spirituality and of a kind of larger perspective on life, and appreciates how important other people can be, creating a therapeutic team, but also creating a healing community. How important those five characteristics that those five characteristics be included in the person you're looking for. Now with the internet, we have much easier access to those kinds of people. It's a lot harder 40 years ago.
Mm-hmm.
So, but now there are people who describe themselves as integrative or holistic, and they have descriptions of their practice. The other thing I would do is that I would check with your friends, find out somebody. The best referrals are always from friends. find out somebody who has gone to see such a person. Many of the people who come to me for cancer, for example, people who want an integrative approach to cancer over the years, those have been people referred by other patients. They said, "Oh, you have breast cancer or you have ovarian cancer. I went to see Dr. Gordon or Jim," as they sometimes say, and he helped me uh, figure out what to do, and he helped me design a program, and he helped me through the whole cancer journey that I was on. So you're looking for somebody who will really be there for you, a true physician, whether the person is an MD or not. That's not the crucial factor. So I think that's what's most important. And then I always I always suggest that it's really important to have some kind of initial session where you have an opportunity to ask hard questions. I've done that over the years on the phone with people, and I didn't charge them. And I told them to read my book. I used to tell them years ago I'd read an article. Now I have a book on cancer called Comprehensive Cancer Care. I have a book on psychological issues and stress called Unstuck, Your Guide to the 7-Stage Journey Out of Depression. And another book, a more general book called Manifesto for a New Medicine.
Mm-hmm.
So I suggest, read the book and think about it. And if you're still interested, give me a call back. And the other thing I say to people that's really important is you have your oncologist. That's fine. I'm not going to take your oncologist's place. The work you're going to do with me is really going to engage you. You're going to do most of the work. I'll do what I'll give you guidance. I'll give you help. I'll give you some, advice about what to do. But most of what I'm going to be working with are techniques of self-care, of
Mm-hmm.
self-awareness and self-care. And I'll be there to teach you those techniques. And I think it's really important that whoever those who are watching us, our audiences, goes to, that they need, even if they don't get it perhaps from the primary care physician, they need someone to help them learn the techniques of self-care that can benefit them. I mean, for example, we know, and I'm sure many of our viewers know, that nutrition and exercise are very powerful in both preventing various kinds of cancers and helping to prevent recurrences.
Mm-hmm.
So you should be, and also so is reducing stress. And so is social support, and so is meaning and purpose in life. So those need to be things that we're paying attention to, because these are as real and as important as chemotherapy or surgery or radiation. They should, and the other thing that's really important is not to wait. Unfortunately, some oncologists who are even sort of sympathetic to this approach say, well, wait till you're finished with conventional therapy before you get a program of exercise or nutrition. And I would say just the opposite, or even stress management. I'd say start right at the beginning. Once you have the diagnosis, if you don't already have a program in place, find someone who can help you create such a program.
If ever you're under stress, it's when you're going through cancer treatment. And stress management, I think, is a critical piece of it. You brought up another point that I think people really overlook, and I personally think it's incredibly important, and that is that sense of community and support. I think in this modern age, in spite of all the wonderful aspects of social media and the internet, and I think it brings a lot of really good things to the table, particularly in cancer care, but I think we live very fractured, disconnected lives overall. And I think that sense of community is a piece of the equation that is more important than perhaps we recognize.
I couldn't agree with you more. A lot of the work we do at the Center for Mind-Body Medicine is with psychological trauma. And of course, we work in war zones, post-war, post-disaster situations. People who want to learn about us, the website cmbm.org, Charlie Mary, Betty Mary.org. And we work with trauma here in the United States. And one of the major causes of trauma for us here in the United States is medical illness of one kind or
Yes.
another. And its treatment also is traumatic.
Going into the hospital is traumatic.
Yes. We have to work on that too. We can come back to that in a sec. But so the single most important intervention for psychological trauma, for that aspect of whatever we're going through, is social support. I mean, everybody who works with trauma agrees. So what is really important is to have somebody who is there for you. So you should have somebody who goes to all your medical appointments with you, because you go to a medical appointment, you have a life-threatening illness, you're kind of in a state of shock, and you need somebody who's got a little bit more clear-headed and maybe cold-blooded to sort of sit there and ask the hard questions and insist on answers. And somebody who's there who will really, do the things that are difficult for you to do when you're going through this whole process of confronting a serious illness. The other thing that's really important, second thing, is reaching out to people generally. My experience is that family members and friends really like being helpful. Most of us are so afraid, oh, I don't want to bother them. I shouldn't do that. I'm supposed to be strong.
They don't know what to do or say. It's a complex problem, actually.
Yeah. And my experience is overwhelmingly that friends and family members like to feel useful. Human beings like to feel useful to people they care about. So that's the second. And the other is we work with small groups. I think there are many kinds of support groups. And what I would say is that they all can be of some benefit, but I think it's the most powerful kinds of groups based on our research and research by other people like Dean Ornish, John Kabat-Zinn, Alastair Cunningham, or really small groups with a constant membership where people are learning techniques of self-care that they can safely share, learn, and share their experience with one another. And this is crucial. We've done a tremendous amount of work at Center for Mind Body Medicine in training health professionals and patient advocates and peer counselors to lead these groups. And I welcome, viewers can look on our website and they can look at our trainings. We welcome people who would like to learn how to lead these groups. You don't have to be a health professional, but it's really important. Drop-in groups can be helpful, but to have a group where every week I'm going to see the same people. And each week I can share, I can take another chance, go a little deeper. They know me a little better. I know them a little better. This is a very, very powerful way for people to get help and healing. And it's also built into our DNA. Our ancestors, for as long as we have any kind of history at all, oral or recorded, when somebody was really sick, a group would be brought together. And it could be the family or it could be the whole community, and people would share. They were there for each other. And it's not a matter of fixing people. It's a matter of giving them a chance to know themselves, to be themselves, and to learn how to help themselves and to feel that connection with other people.
And to receive that healing energy, for that matter, from a group like that. Does technology have a role to play in this?
I'm sorry?
Does technology potentially have a role to play in this?
Yeah, we're now exploring, and maybe we can talk about it some other time. We're in the process of exploring doing these groups online.
Oh, I'd love to talk to you about that.
Yeah, we haven't done it up till now, partly because being in person is so powerful, but we're realizing that in order to reach so many people, in order to reach really large numbers of people, and people whose resources are very limited, we want to be able to work online. So it's something that we're just beginning, and we're just beginning to pilot some of these groups online. And I think they will work. I don't know how well, and we're going to study it. We're going to see how well. So I think that's one place that technology has an enormous role. The other is just, and people do get a great deal out of posting on Facebook and hearing back from other people. I mean, some people more than others. It's not my preferred medium, but I put some things up, but I'm not really somebody who follows or pays that much attention for the most part, but other people do. And I think we have to be very flexible. I have to be flexible too. How do we get out information? Mm-hmm. And if Facebook is the way, that's beautiful. But I think really, whether it's working when we have our online groups or creating your own support group online, I think that can be very helpful, particularly if friends and family are scattered around the country, as they are for so many of us. I think it can make a real difference.
I agree. I think social media actually has a very positive role to play in connecting people, because I think for many people, particularly going through cancer, it doesn't matter what type of cancer they have. On an emotional level, they're sharing very similar experiences. And
absolutely.
And I think that connection is valuable. And I also think that the ability to see that commonality of the experience across geographies, across cultures, it puts it in perspective for the individual. And I think that can be really helpful too.
I agree. You know, one of the things that we've done over the years for in-person groups is some people like to be in a group with other people with cancer. Some people say, I don't want to be in a group with everyone with cancer. So we put them in a group with, people who have hypertension and anxious medical students and housewives who are ready to kill their husbands, all different. And it works both ways.
Yeah.
It works if you can just bring a group together and give people a chance to share with each other in a way that's comfortable for them. And I think it could go either way. It could be, I want people who have similar experience, or I'm fine with lots of different people. The other thing I think that's really important, and I'm sure this is a function you serve, is people need information from sources they really trust. I mean, if you go on I go on the internet, somebody will tell me about X, Y, or Z, and I'll, an herb or a treatment or something, and I'll go on that I've never heard of, and I'll go on the internet. I said, how in God's name do people figure out what good information?
Then there's the asparagus diet, which of course will cure cancer. No, it's a little crazy sometimes. And I think the key is you have to have an open mind, but you have to be discerning. And you have to find people you trust that can help guide you through this maze.
Absolutely. That, for years, we haven't been doing it the last few years. We spent a lot of time, at least once, maybe sometimes twice a year, we were training cancer guides, health professionals, patient advocates, peer counselors who could help people make the wisest decisions about what to do and what not to do once they've been diagnosed with cancer. I think that function, whether we're training those people, which we're not doing right now, or just somebody who can step into that role, is crucially important. To have somebody who can sit with you periodically and say, just go over the information with you, be a sounding board so that you can, go back to her or him and say, look, I went to see this doctor and this is what he said, and it doesn't make any sense to me. What do you think about it? Just to have somebody like that there can make a big difference.
Are we going to see a change in the way medicine is practiced? Will it start to integrate more of this holistic approach, do you think?
Yes, but it's still very peripheral. Most of the programs of integrative medicine and integrative cancer care in most of the universities and most of the major hospitals, not all, they're there, but they're kind of peripheral. It's like another specialty. But we're not talking about a specialty. What's crucial, the next step, in the beginning, okay, but now it's time for that kind of integrative approach to be available to everyone at every stage of their condition and when they're healthy.
Of life.
Yes, exactly.
Yeah.
And presented by somebody who doesn't have an economic stake in people doing X, Y, or Z, or even if they have a stake, if they're willing to let go of it. So for example, let's say I'm giving chemotherapy. If I really, this is what any good doctor should do. If I really think the chemotherapy isn't going to be of major service, or the benefits are only marginal, I need to say that to somebody, and I need to help them look at other possibilities. I'm thinking of a friend of mine who was the head of an oncology department at one of the country's foremost cancer hospitals. And when he had a late stage colon cancer, his oncologist, who was his friend, said, well, we're going to do another round of chemotherapy. And he talked about this. Bill's his name, Bill Fair, who was actually very famous surgeon. And Bill said, I've read up on this and I've read all the trials, and it really isn't going to do any good as far as I can tell. There's almost no chance it'll do any good, and there'll be a big downside. And the oncologist said, well, I want to do something for you.
Oh.
And I think that's another piece. That I don't think he had any financial motive at all, but he wanted to help somebody he cared about. But in doing that, he lost his own objectivity. And Bill, to his great credit, he said, no, I think I'm going to do some other things. And so he looked around and he did Chinese herbal therapies and acupuncture, and he did mind-body approaches, and he lived 5 years beyond what anybody expected.
And those are the stories I like to hear, because I think there's huge validity in this mind-body holistic approach to health. And nobody gets out alive, but we can have good quality of life, good quality of mental health, physical health, psychological health, spiritual health while we're here.
Absolutely. And, you know, and we want people to support us in making, I mean, doctors, oncology professionals are very important. They play a huge role if we have cancer or a family member has cancer. So we want, the other thing that I would just say to our viewers is you may need to educate your oncologist
Oh,
and your
absolutely.
oncology professionals. Hopefully they're already doing it. I always tell all my patients now, you go back and you tell your oncologist exactly what we're doing. And you say, since it's making you feel so much better, he or she needs to know, because we have to expand the education. And that's a slow process. Medical education is very conservative, not necessarily in the best sense of that word. It changes very slowly.
Oh, I think you're at least a generation off from seeing significant change there, but I think technology can expedite that. And actually,
So.
when we get off, there's some folks I want to put you in touch with. But I want everybody, I have a copy of Manifesto for a New Medicine, here. I don't know if you have a copy of any of your other books. I'll
Sure.
put them up on the website, but I cannot tell you what a remarkable book this is. And I would recommend that there are a few books I recommend that people always read. This is one of them. David Servan Shriver's Anti-Cancer, A New Way of Life.
Great book also, yeah.
I also suggest if they can get through the medical aspects of it, Dean Ornish's wonderful study on prostate cancer is truly head-turning. And I think that everybody should understand the implications of the work that he's done as well.
Great. And I'll just show you a picture of Unstuck, which is the book on dealing with stress and depression and anxiety, and step by step with lots of practical self-help techniques, and also a lot of resources in the back, including people in how you can reach out and find people in your community who use mind-body approaches and use a holistic approach. And then just, if people are interested, this one's a little dated. It's the Comprehensive Cancer Care book. And there's more new information, but I think it's a very good handbook for how to approach dealing with the condition and dealing with and making judgments about what to do and what not to do. So I'm glad you love Manifesto. These are some of my children, and I have to promote them all, right?
It's really a remarkable book. I wish I had found it earlier. I came to a lot of my conclusions after doing just tons of reading all over the place, and also I think listening instinctively to what made sense to me. And I think Manifesto for a New Medicine should be required reading for just everybody.
All right, thank you. That's great.
Thank you. I appreciate your time today very much. And maybe we can do it again sometime, because I could talk to you for days.
I'm very happy to do it again. I like talking with you too. You're great. You're great at doing this. And yeah, let's see, there may be ways we can work together too.
That'd be great. Thank you.
Okay, thanks so much, Pat. Bye-bye.